So there's an announcement about the new health care law expected today from the Obama administration, while more governors say that they go public saying that they will not put the law into action. At least 16 states so far. This is a report surfaced that the Health and Human Services Department will step in and create these insurance exchanges for the states that are not willing to set them up. Well, the governor of one of those states is Robert Bentley, Republican from Alabama. And sir, good morning to you, Governor, and thank you for your time here.
Good morning, and thank you for having me.
Sure. Why a no-go on Obamacare in Alabama?
Well, I've been opposed to this legislation from its inception. As a physician, I have felt that this is not the way we need to go in this country, and I do believe that we need accessible and affordable health care, but certainly not what has been proposed by the federal government.
The question is why, though? Is it money? Is it implementation?
Well,
what is it?
I think there's several reasons. Number one is I think that what has been proposed is unworkable. And of course we have we've had the choice of whether or not to set up a state-run exchange or a partnership, or whether or not the federal government will set up a federal facilitated exchange. Actually, I don't believe that a federal facilitated exchange is constitutional.
I'm reading a quote from you about the Affordable Care Act, the ACA. You call it the single worst piece of legislation to be passed in your lifetime. What makes it so bad?
And I agree with it. Well, 2,700 pages, 17,000 pages of regulations, and only a third of those have been set up. It is an unworkable law. And I don't believe that the federal government will be able to come in and set up federally facilitated exchanges. As I said, I think that's unconstitutional. And I think it's already been ruled in Prince versus the United States in 1997. This was cited in the 7-2 mandate ruling that the courts ruled on. And we just don't believe that's constitutional. And if we don't set up our own exchange, because that's what the federal government actually wants us to do, they don't want to have to come in and set up exchanges. We believe as many as half of the states, maybe more, will not set up a state exchange or a partnership exchange.
Well, we've got a list of 16 so far. You talk about a tax burden in Alabama of $50 million plus. The other side is saying you're just playing politics on this and you're leaving a lot of money on the table that could otherwise be spent helping the people of Alabama. What do you think about that charge?
Well, let me first answer that first question. It will cost, if we set up a state exchange, they will give us money to set it up, but those who are in the exchange have to pay for that with fees and taxes. And in Alabama, we estimate that'll cost the people of Alabama approximately $50 million annually. And we just can't afford that.
Do you have any idea what the Health and Human Services Director will say today, Kathleen Sebelius?
I have no idea what they'll say. You know, honestly, I think that when we have half of the states that refuse to set up a state exchange, it makes it very difficult for them to implement this law. It is not a foregone conclusion that this law that has been passed, that it will be implemented. It is not a foregone conclusion that that will occur.
Just one more question then. Do you expect, based on a series of answers you have given us here today, that this goes back to the U.S. Supreme Court, fought on different grounds legally?
I do.
Governor, thank you. Robert Bentley's the governor of Alabama. He's a no-go in Obamacare for now, sir. Thank you for your time, and we'll see what Kathleen Sebelius says at the noon Eastern hour from Washington. Thank you. Here's Mark.